Cold open. I was on a week-long train trip, 2 backpacks, 1 wildly optimistic snack stash, and my little cousin twisted her ankle on a rocky platform. We didn't panic. We had a small cloth, some salt, and a jar of honey. A quick saline rinse, a tidy honey dressing, and calm. That night, a ginger chew settled her queasy stomach from the bump. Listen to your body. This absolutely calmed us down until we could check in with a clinic. Today, we build that kitchen first aid confidence. Simple, safe tools you can trust.
Welcome back to Earthy Remedy. I'm Fiona. Today, we're talking practical, what to keep within reach for minor scrapes, travel nausea, headaches, and sore muscles, and exactly when a wound or symptom needs professional attention. The evidence matters here, what actually helps and what could make things worse.
And I'm Samnang. Real quick, our goal today is so simple. Give you a compact, safe kit you can assemble with pantry staples and a few herbs, plus crystal clear rules for when to call in clinical care. Start small. You've got this.
The problem. Picture this. A toddler scrapes their knee playing in a neighbor's yard. A commuter gets slammed with travel nausea. An office worker wakes up with a tension headache before a big meeting. Or someone pulls a muscle while moving furniture. Those are everyday moments that can feel big in the moment. We want you to feel capable, not alarmed.
Nutritionally and physiologically speaking, many of these moments come down to inflammation, minor surface contamination, or autonomic upset like motion-related nausea. Small, time-limited interventions like a saline rinse, antimicrobial dressings for clean superficial scrapes, or a ginger tea for nausea can reduce discomfort and keep things from getting worse. But we need to underline the limits. Deep wounds, heavy bleeding, signs of infection, or persistent neurological symptoms require urgent care.
To help us sort the helpful from the risky, please welcome our guests. Amar Singh is a community herbalist who runs neighborhood workshops on low-risk, high-impact remedies. Amar, welcome. I'm excited for your practical wisdom.
Thanks, Samnang. Really glad to be here. I teach folks how to keep care gentle and accessible, what to use from your kitchen, how to test for sensitivity, and how to respect both the herb and the person. I'm excited to share things that have really helped in community settings.
Also with us is Maria Chen, an ER nurse who's seen the full range of what happens when home care is helpful and what happens when we miss red flags. Maria, welcome.
Thanks for having me. I want listeners to feel empowered, but also safe. I'll be here to flag when something's beyond first aid and needs urgent medical attention. Small injuries are common, but it's the warning signs we can't overlook.
Segment 2, Evidence and Tradition. Amar, start us off. From your community practice, which low-risk preparations reliably help in the moment, and why?
In my experience, 3 things do a lot of good when used thoughtfully: clean water or saline for irrigation, honey for its antimicrobial and healing assistive qualities on superficial wounds, and ginger for nausea. These are easy to access, and they work because of known properties: honey's osmotic effect and its peroxide contributors, ginger's gingerols that act on gut motility and nausea pathways, and saline's simple mechanical cleaning that reduces surface pathogens.
The research supports that. The evidence shows that. Medical-grade honey preparations can reduce bacterial load and promote healing in minor wounds. Ginger is well supported for nausea in multiple studies, including travel-related nausea. And saline irrigation is the first-line approach for cleaning superficial wounds because it physically removes debris without irritating tissue. That doesn't mean every kitchen honey is the same or every ginger preparation is interchangeable, so details matter.
From the emergency perspective, irrigation and keeping a wound clean is the first step. But I want to emphasize red flags: uncontrollable bleeding, deep puncture wounds, wounds with embedded debris that can't be washed out, signs of infection like spreading redness, warmth, fever, or red streaks toward the heart, and any altered sensation or loss of function. Those are times to get professional care right away. Also, if someone hasn't had an up-to-date tetanus shot for a dirty wound, that's a prompt for medical attention.
Good. Let's be concrete. Segment 3. What belongs in a kitchen first aid kit? Quick list. clean water or a small bottle of sterile saline, a jar of raw honey, ground ginger or fresh ginger root, peppermint oil or dried peppermint for headaches, powdered turmeric for topical use only in specific safe ways, clean cloths, adhesive dressings, gauze, a small jar of plain coconut oil or olive oil as a base for rubs, and labels for pregnancy or medication cautions. Amar, would you add anything?
I'd add a small measuring spoon, a little funnel or dropper for making dilutions, and a tiny travel tin for a ready-made herbal rub. And always a pen and masking tape to label things, especially if you're making a remedy for someone who is pregnant or taking medications.
I'll add an allergy checklist card. Write down common allergens like honey, nuts, and latex, and whether the person is pregnant or taking blood thinners. That helps you decide which remedies are safe in the moment.
Segment 4. Repair and remedy demos. We'll go step by step. Everyone set a comfortable tempo. We'll speak slowly for listeners who might be cooking along. First demo, making a sterile saline wash.
Saline for cleaning wounds. Step 1. Bring 1 cup of clean water to a roiling boil for 1 minute to sterilize it. Let it cool until it's warm but not hot. Step 2. Add 1/4 teaspoon of non-iodized salt to that cup and stir until dissolved. That's roughly isotonic and gentle on tissue. Step 3. Pour or use a clean syringe or cup to gently irrigate the wound from the center outward to avoid pushing debris deeper. Do not use hydrogen peroxide or alcohol directly in the wound. They damage healthy tissue.
If bleeding is heavy, apply firm pressure with a clean cloth and elevate the limb. Saline is for superficial cleaning, not for deep or heavily contaminated wounds. If you can't remove visible debris with gentle irrigation, or if the wound is deep or caused by an animal or dirty metal object, go to urgent care or the ER so professionals can assess and possibly give a tetanus booster or antibiotics.
Next demo, a honey dressing for minor scrapes. Amar, walk us through the safe way to apply honey.
Step 1. After cleaning with saline and drying the area gently, place a very thin layer of raw honey on a piece of sterile gauze, about a half teaspoon for a small scrape. Step 2. Lay the gauze over the wound. Secure with a bandage so it stays in place, but not so tight that it cuts circulation. Step 3. Change the dressing once a day, or sooner if the dressing becomes saturated. When you remove the dressing, re-clean with saline and check for excessive redness or foul smell. If you see spreading redness or pus, stop home dressings and seek care.
A quick note on honey. Medical-grade honey is standardized and ideal, but raw honey from a trusted source can be used for small, clean scratches. Allergy check first. If the person is allergic to bee products, do not use honey. And for infants under 1 year, do not use honey at all.
Next demo, ginger for nausea, 2 easy approaches. First, a quick ginger chew for immediate relief. Step 1, peel a piece of fresh ginger about the size of your thumb and slice it into thin coins. Step 2, take a small slice, press it between your teeth, and let it sit in your mouth to release juice for a few minutes. If that's too strong, make a small ginger tea. Step 1, slice 1 tablespoon of fresh ginger. Step 2, steep in 1 cup of hot water for 5 to 10 minutes. Step 3, sip slowly. For children, reduce the quantity, half a slice or weaker tea, and check with a caregiver.
Ginger works because it helps gut motility and acts on nausea receptors. If fresh isn't available, dried ginger powder can work. Use about half a teaspoon in hot water. And for people on blood thinners, check with a clinician before habitual high-dose ginger use, because there can be interactions at higher doses.
From a biochemical perspective, gingerols and shogals modulate pathways involved in nausea and vomiting. The doses used in studies vary, but short-term, culinary doses, like what we described, are generally safe for most adults. Still, if vomiting is persistent or if there's severe abdominal pain, go to the clinic.
Demo D, peppermint for headaches and a cooling compress for sore muscles. For a quick peppermint spritz, steep 1 tablespoon of dried peppermint or 1 peppermint tea bag in 1 cup of hot water for 5 minutes. Cool, then pour into a spray bottle for a quick mist to the temples and back of the neck. For a cooling compress, soak a clean cloth in cool saline or mint-infused water, wring it out, and rest it over the sore area for 10-15 minutes.
Peppermint's menthol can help with tension-type headaches by cooling and easing muscle tension. But don't apply peppermint oil undiluted near eyes or mucous membranes. Always dilute 1 to 2% in a carrier, like fractionated coconut oil or olive oil, and patch test on the forearm first.
And finally, a simple topical muscle rub base with safe herbs. Step 1. In a small jar, mix 2 tablespoons of carrier oil, like olive or coconut, with 1 teaspoon of dried arnica or a pinch of powdered turmeric blended well. Step 2. Add a couple drops of diluted peppermint if tolerated. Step 3. Label it and use a small amount rubbed into the sore area. Stop if irritation develops. Note, arnica is for topical use only and not for use on broken skin.
Important nutrient and safety note. Turmeric can stain and can interact with blood thinners at higher systemic doses. Topical use in small diluted amounts is lower risk, but still check with a clinician if you're on anticoagulants or pregnant. And never apply powder directly to an open wound, as it can trap debris and harbor contamination.
Segment 4D, Substitutions and Accessibility. If you don't have raw honey, maple syrup is not an antimicrobial substitute. It's okay for mild comfort in a non-wound beverage, but not for wound dressing. For ginger, candied ginger can offer some relief, but has sugar. Dried ginger powder is the most accessible swap. For a pincushion budget, small jars, folded cloths, and bandages can come from a dollar store. For pregnancy-safe swaps, avoid honey dressings only for infants. For pregnant people, avoid high-dose herbal extracts and always check with a clinician for herbs like arnica or essential oils. For kids, reduce doses and prioritize saline cleaning and soothing teas.
Do a quick patch test for topical items. Apply a pea-sized amount of the rub to the inside of the forearm, cover with a bandage, and wait an hour. If redness, itching, or swelling appears, wash it off and don't use it near wounds. For allergic reactions anywhere on the body, hives, swelling of face or throat, trouble breathing, call emergency services immediately.
Segment 5. Safety, contraindications, and when to seek care. Quick checklist of red flags to stop home care and seek help. Deep wounds, heavy bleeding that doesn't stop with pressure, wounds with visible bone or open joint, foreign bodies that can't be removed, signs of systemic infection like fever or spreading redness, altered consciousness, severe abdominal pain or persistent vomiting, and breathing difficulty for allergic reactions.
We also need to talk herb, drug, and pregnancy cautions. Fiona, can you summarize the top interactions listeners should be mindful of?
Sure. Major highlights. If someone is on blood thinners, check before introducing regular turmeric or high-dose ginger. Peppermint and menthol topicals can affect certain medications when overused. Essential oils should be used sparingly and always diluted. If someone is pregnant or breastfeeding, avoid recommending systemic high-dose herbal extracts. Stick to saline, ginger culinary doses for nausea with clinician approval, and avoid topical herbs that aren't clearly safe in pregnancy without medical advice. When in doubt, the safe rule is check with your clinician before making herbs part of a regular regimen.
And build a simple habit. Label everything with the maker's name, date, and any contraindications. Keep a small card with allergy information in the kit. In community classes, that small step has prevented a lot of confusion.
Segment 6. Packing and travel tips. Make a compact kit. Fold a small plastic container with separate compartments for gauze, bandages, a tiny jar of honey, an amber travel bottle of saline or distilled water, a small screw-top tin for your rub, and a printed checklist. Keep it in an obvious place in your bag and refresh supplies every 6 months.
When traveling, have an emergency contact and medication list accessible. And if you're going remote, consider a satellite communication option. For kids, include a note about dosing adjustments and any chronic conditions. These details make a big difference in triage if you need to escalate care.
Reflection and encouragement. This is more than a kit. It's a small practice of care. Take a breath when something happens. Clean, be gentle, check for red flags, and use simple remedies to relieve discomfort. trust the process. Let nature help and know your boundaries.
The bottom line is simple, evidence-aware actions, saline irrigation, mindful honey dressings for small clean scrapes, ginger for nausea, and diluted peppermint for tension can be supportive. But if in doubt about depth, bleeding, infection, or systemic symptoms, seek professional care. That's the safest path.
We want to see your kits. Snap a photo of your kitchen first aid setup or record a quick voice note about a time a simple remedy helped you. Tag us on Instagram at Earthy Remedy or send a message. Share your tweaks, your favorite substitutions, and your questions. We'll include a printable checklist and step-by-step recipe card for everything we covered in today's show notes.
Thanks to Amar and Maria for sharing such clear, practical guidance. And thanks to you for listening. Take care of the small things. They get up. And of course, listen to your body. Trust the earth. Feel the difference.
Closing, if this episode helped you feel a little more prepared, subscribe to Earthy Remedy so you don't miss our next how-to. We'll be back with more simple, nourishing practices. You've got this.